Stroke does not always come without warning. Stroke does not come suddenly. 6. Warning signs. Your brain is crying for help. You are having breakfast and talking normally with your family, when suddenly one of your arms feels slightly weak. You think maybe you just slept in the wrong position. A few minutes later, everything feels normal again, so you continue your day as if nothing happened. 3 days later, you wake up in the hospital and realize that one side of your body can no longer move. This is not a rare story. In reality, many stroke patients had warning symptoms before the actual stroke happened, but they ignored them because they thought it was just fatigue, lack of sleep, or a change in blood pressure. The important thing to understand is that stroke usually does not appear instantly. It is often the result of blood vessel damage that has been developing silently for many years. That is why the brain often tries to send warning signals to the body before a real stroke occurs. If these signals are recognized early and the person gets to the hospital in time, the chance of recovery can be much higher. First, we need to understand what is happening inside the brain. Although the brain makes up only about 2% of body weight, it uses nearly 20% of the oxygen we breathe every day. The brain has almost no ability to store oxygen. That means when blood flow is interrupted, even for a short time, brain cells can begin to suffer damage. Studies show that during a stroke caused by a blocked blood vessel, millions of nerve cells may be lost with every passing minute. That is why neurologists often say, time is brain. The earlier treatment begins, the more brain cells can be saved. So, what warning signals does the brain often send before a stroke happens? The first sign is a sudden change in facial balance. One corner of the mouth may droop. When the person smiles, the two sides of the face may no longer look even. Sometimes the patient does not notice this change at all. The person standing nearby may be the first one to see it. If you notice that someone's mouth is drooping or their face is suddenly leaning to one side, do not wait to see if it goes away. It could be an early sign of brain injury. 6 warning signs and the BE FAST rule. The second sign is sudden weakness in an arm or leg. You may hold a glass of water, but feel that your grip is no longer steady. You may walk up the stairs and suddenly feel that one leg is heavier than usual. Some people may be writing when the pen suddenly falls from their hand. The key point is that this weakness appears suddenly and usually affects only one side of the body. The third sign is a sudden change in speech. You know what you want to say, but the words do not come out clearly. Or you may speak a lot, but other people cannot understand what you are saying. In some cases, the person may simply be unable to read a short sentence, even though they were completely normal just a few minutes earlier. This is one of the most important warning signs of stroke. The fourth sign is an unusual change in vision. Some people suddenly have blurry vision in one eye. Some people see double. Others may lose part of their field of vision. This symptom may last only a few seconds and then disappear, which makes it very easy to ignore. The fifth sign is loss of balance. The person may walk unsteadily, almost like someone who is drunk. They may bump into a wall or be unable to walk in a straight line. If this happens suddenly when the person was completely normal before, you should think about a possible problem in the part of the brain that controls balance. The sixth sign is a severe headache unlike anything before. Not every headache is a stroke. But if the pain appears suddenly, feels like the worst headache of your life, and comes with vomiting, blurred vision, or weakness in the arms or legs, emergency care is needed immediately. Today, doctors around the world use a simple method to recognize stroke quickly. It is called BE-FAST. B stands for balance, meaning sudden loss of balance. E stands for eyes, meaning sudden changes in vision. F stands for face, meaning facial drooping or an uneven face. A stands for arms, meaning weakness in an arm or leg. S stands for speech, meaning difficulty speaking or slurred speech. And T stands for time, meaning you must call emergency services immediately. If even one of these signs appears, it is enough reason to go to the hospital as soon as possible. Risk factors, common mistakes, and prevention. Many people still think stroke only happens to older adults. That is no longer true. More and more patients under the age of 50, and even under 40, are having strokes. Part of the reason comes from smoking, obesity, lack of physical activity, diabetes, high blood pressure, and long-term stress. Atrial fibrillation, a common type of irregular heartbeat, can also increase the risk of blood clot formation. The worrying part is that many people with atrial fibrillation have no symptoms at all. They only discover it after a stroke has already happened. One very common mistake is ignoring symptoms because they disappear on their own. This can be the most dangerous moment. A transient ischemic attack, sometimes called a mini-stroke, may be the final warning before a major stroke happens. If this opportunity is missed, the consequences can be very serious. Another mistake is driving yourself to the hospital. While driving, the person may suddenly lose consciousness or lose control of their arms and legs, causing an accident that could harm themselves and others. The best choice is to call emergency services or have a family member take the person to the hospital. While waiting for emergency help, do not give the person food or water, because they may choke if their swallowing ability has been affected. You should also not give aspirin or blood thinners on your own if you do not know whether the person is having an ischemic stroke or a bleeding stroke. These two conditions require completely different treatments. To reduce the risk of stroke, the most important thing is to protect your blood vessels early. Control your blood pressure, blood sugar, and cholesterol under a doctor's guidance. Maintain a healthy weight. Exercise at least 150 minutes each week. Eat more vegetables, fruits, fish, and whole grains. Reduce processed foods, sugary drinks, and foods that contain too much salt. If you smoke, quit as soon as possible. After just a few years of quitting, the risk of stroke drops significantly compared with continuing to smoke. Do not forget regular health checkups, especially if someone in your family has had a stroke or heart disease. Many risk factors can be detected early with simple medical tests. The most important thing to remember is that stroke does not always come without warning. In many cases, the body has already been sending signals hours or even days before it happens. If you know how to recognize those signs and act immediately, you can completely change the final outcome. Sometimes, choosing to go to the hospital just a few minutes earlier can help someone keep walking, speaking, and living normally for many years afterward. Brain health is not decided by luck. It is decided by knowledge, awareness, and the right action at the right time. If you find this video helpful, share it with your family and friends. One day, this knowledge may help save someone you love.